I'm here once again today with Bonny Specker, epidemiologist from South Dakota State University, who is going to be talking to us about how hospitalizations are predicted and also give us a weekly update of what's been going on with COVID-19 in our area and in the world. So Bonny, what do you have for us today?
Hi, thanks, Chelsea. What I thought I'd talk about today is one of the three criteria that are on the City of Brookings threshold document. We have a committee that meets once a week and we go over these different indicators. And one of them is looking at whether the health system is able to cope with the resurgence of COVID cases that might come about. And this is just an example. We will provide some data to Jason Merkley at Brookings Health System, and then he will incorporate that into a recommendation. And this particular one says, based on current census, Brookings Health System feels they can handle the lowest of the anticipated numbers, 5, but that staffing may be challenged, limiting the ability to sustain care for the long term with the highest anticipated number, which in this case was an N of 17. So where does that 5 and 17 come from? I thought it would be good to talk about that. This is an example of the table that is provided to Jason and discussed among the committee members. And we have here two different estimates. Well, 4 estimates, but one of them is based on anticipated admissions based on the number of new cases in the previous week. And the other one is anticipated admissions based on the number of active cases, because we aren't really sure which is most important. Is it the new cases that have come about, or the number of active cases that can still get sick and require hospitalization? And those two numbers, especially in November, could be really different when we had a rapid increase in the number of cases. And we calculate estimated hospitalizations based on either the overall state hospitalization rate or using age-specific hospitalization rates. And I'd like to go through how those two are different. In this example, on December 18th, there had been 108 new cases of COVID in Brookings County. And this was based on numbers that come off the DOH dashboard, and we keep track of those every day. And we added up on December 18th how many cases had been diagnosed in Brookings County in the previous week. So there were 108 there, and we had 245 active cases of COVID in Brookings County on December 18th. Okay, we also had an overall hospitalization rate for the state of South Dakota of 5.7% on this particular date. So that's going to be used in a little bit. And we had age-specific hospitalization rates as of December 18th. You can figure that out from data based off the dashboard. And then there was an age distribution of cases between December 2nd and December 9th. And this comes from the daily data report that's sent out that is available online on the city website, but we'll go over that as well. Now, this is an example of the age-specific hospitalization rates as of December 18th. And what we do for each age group, we calculate the percent of cases that are hospitalized. And that's done, it's from the beginning of time, and it's done as the number of people hospitalized divided by the total number of cases within that age group. So for example, in the 60 to 69 age group, there have been 1,105 people hospitalized, And there have been 11,048 people within that age range that have been diagnosed with COVID. So when you calculate that out, it comes to 10.1%. So we're going to use these individual hospitalization rates, or these age, we call them age specific because they're specific for those age groups, later on when we calculate the expected number of hospitalizations based on age specific rates. But to do the overall hospitalization rate, we just sum up everyone that's ever been hospitalized from COVID. And on December 18th, that was 5,561 people divided by the total number of COVID cases, which was 97,390. And when you calculate that out, 5.7% of the people who have been diagnosed with COVID or have tested positive have been hospitalized. So kind of the middle, but you can see a very age-dependent effect here with older people, a higher percent of them being hospitalized than the younger people. So if we look at basing it on overall hospitalization rates, what we do is we take that number of new cases in the past 7 days and simply multiply it times that total hospitalization rate of 5.7%. And we come up with an N of 6 that we expect to be hospitalized in the next week. Or if we base it on number of active cases, we come up with an N of 14. Now, the World Health Organization recommends adding, 20% more just to make sure that you have sufficient capacity in the hospitals. And if you add 20% more, you come up with these numbers that are in parentheses. As I mentioned, in order to figure out the number of expected hospitalizations based on age-specific rates, we need to know a couple things. One of them is the hospitalization rates by age, and the other one is the age distribution of cases in Brookings County. And as I showed previously, we have the hospitalization rates by age. These are the data as of December 18th. But to come up with the Brookings County data, this is not something that's available on the Department of Health dashboard. So this is requested from the Department of Health on a pretty much weekly basis. But if you look at the dates along the bottom here, they're not exactly the same. Like, we don't get it exactly every 7 days. But there's a couple things that's interesting to note in this slide, even regardless of estimating hospitalizations. And this is a slide that is available on the City of Brookings website in the daily downloads or weekly downloads. Here, let's just look back here in September. What this is telling you is the age distribution of the cases within Brookings County. And our biggest chunk at that point in time was the 20 to 29-year-olds. And this is the legend down here showing you what the colors, what the age groups are. But essentially, we're starting down here at the bottom with the youngest. These are 0 to 9, 10 to 19, 20 to 29, 30 to 39, 40 to 49, and on up. And you can see that over time in Brookings County, what has happened is the older ages, a higher percent of the total number of cases in Brookings have come from this older age group. So early on, we had younger people being diagnosed with COVID, and now we have about close to 50% of the people that have been diagnosed are 30 years and older, compared to back here, it was about 20%. So there's been a big shift in the age distribution. And if you think back on that graph that showed the hospitalization rates by age, those increase with increasing age. So back here, we're not going to have very many hospitalizations because most of the people with COVID have been younger. Now it's moving to older people, and that's where we're going to see increases in hospitalizations. But what we have here is describing the increase in the 7 days between December 2nd and December 9th. So we have numbers here of how many people in each of these age groups were diagnosed in this time period. There were 159 new cases within Brookings County between December 2nd and December 9th. So that's what these numbers here are showing. And we're going to use those numbers to predict the age distribution of more recent cases. We're going to use sort of the age that we're seeing in the most recent Brookings data. These numbers here in this first column are coming from that graph I just showed you. These are the recent cases by age within Brookings County. And we're calling this column A so that you can see how these things are calculated. So if we add up column A and we look at what percent of the population in the most recent Brookings data is in each of the age groups. So here, 17%, this 27 divided by 159 is 17% of the cases are less than 20 years of age. So these are the most recent age distribution of Brookings County. And we take this distribution and apply it to the number of new cases we've seen in the previous week. Because if you remember, these cases are from a previous time, but they're the closest time that we have to the current week. So the current week, we have 108 cases. So we take this 108 and multiply it times 17%, and we say 18.3. That's the estimated number of cases that we would have age 20 or less out of this 108 that we've seen in the last week. So we take that last column and we take the hospitalization rates at the state level, that graph that shows what percent are actually hospitalized, 26% in that older age group, less than 1% in the less than 20 age group. And we simply multiply these two, and this is a percent, so you have to take the decimal out. And we come up with an estimated number of hospitalizations for each age group. And we add this up and we come up with a total of 5 expected hospitalizations based on the age distribution, the best guess at the age distribution that we have. So this is looking at 108 new cases. Then we redo the whole thing using 245, the number of active cases at here. So we end up with a larger estimate, obviously. So this is back to that table that we give to Jason Merkley. And this is what we just calculated, this 5, this N of 5, we add the 20% like the World Health Organization recommends. And we redo everything with that 245 as our N. So we've come up with a range of possible estimated hospitalizations, 5 being the lowest and 17 being the highest. So we're going to give that to Jason and we're going to say there's somewhere in between 5 and 17 hospitalizations are what we expect in the next week, you know, depending on which rate we use. So it's just a range. Now, have we done okay based on these predictions? I've just given here the last 4 weeks. Here we have when the projection was made, and it was for the week ending December 4th. And for that week, we had projected between 8 and 29 hospitalizations. And what we saw was 6 hospitalizations and 2 deaths. So we add these two together, being 8. And we say, well, we weren't bad. We were on the low side of the recommendations. Here we projected between 8 and 28. These are actually coming from November numbers, which were quite high. And we projected 11. Here we projected 7 to 27, and we observed 7. Here we projected between 5 and 18. You can see these projections are now going down because we're having fewer cases. So we projected between 5 and 18, and we actually saw 9. So we have been using these age-specific rates for the last 10 weeks. We've overestimated the number of hospitalizations in one of those weeks, and we've been within the range, if we include dates, 9 of the 10 times. The nice thing about using the age-specific rates is Brookings County's age distribution is different than the rest of the state. We have a younger population with the university. So if the cases are young compared to the cases in South Dakota, the overall rate that we come up with will overestimate the number of hospitalizations, because if a lot of the cases are young, there's going to be fewer hospitalizations. So if they're older, the overall rate's going to underestimate. If the Brookings County cases are older than the rest of South Dakota, using that overall state rate will underestimate it because we have an older population. More of them are going to be hospitalized. So just in summary, estimating the projected number of upcoming hospitalizations for Brookings County helps us to determine whether the hospital has capacity. You know, it is one of the best, it's one of many thresholds that we're using to determine what's going on or get an idea of what's happening in Brookings County. But there are limitations to the data, and it is just the best guess that we have. So if you have any questions.
You know, you're using like the last week's data. Is that generally when hospitalizations happen, is like a week after infection? Or
so hospitalizations usually happen 7 to 10 days following diagnosis. That's the average. There are quite a bit of limitations when it comes to the data that we're using, because you have the data we have access to is the data on the Department of Health dashboard. So the date of diagnosis, we don't actually have. We have the date that a case was posted to the dashboard. We also don't have the actual date of hospitalization. What we have is the date that hospitalizations were reported on the dashboard, which could be up to a week off. And the date of the diagnosis of a case can also be off, because if you think about back in November, we had delays of up to 5 days before getting the results back, test results back to a person. So we are missing that 5 day as well. So analysis actually assumes that the shifts are consistent among the different outcomes between when the dates are diagnosed, when you're hospitalized. So there are a lot of assumptions in these data.